Appendicular muscles of the pelvic girdle and lower limbs. The appendicular muscles of the lower body position and stabilize the pelvic girdle, which serves as a foundation for the lower limbs. Comparatively, there is much more movement at the pectoral girdle than at the pelvic girdle. There is very little movement of the pelvic girdle because of its connection with the sacrum at the base of the axial skeleton. The pelvic girdle is less range of motion because it was designed to stabilize and support the body. Muscles of the thigh. What would happen if the pelvic girdle, which attaches the lower limbs to the torso, were capable of the same range of motion as the pectoral girdle? For one thing, walking would expend more energy if the heads of the femurs were not secured in the acetabula of the pelvis. The body's center of gravity is in the area of the pelvis. If the center of gravity were not to remain fixed, standing up would be difficult as well. Therefore, what the leg muscles lack in range of motion and versatility, they make up for in size and power, facilitating the body's stabilization, posture, and movement. Gluteal region muscles that move the femur. Most muscles that insert on the femur, the thigh bone, and move it, originate on the pelvic girdle. The psoas major and iliacus make up the iliopsoas group. Some of the largest and most powerful muscles in the body are the gluteal muscles or gluteal group. The gluteus maximus is the largest. Deep to the gluteus maximus is the gluteus medius, and deep to the gluteus medius is the gluteus minimus. The smallest of the trio, Figure 1 and Figure 2, the tensor fascia latae, is a thick, squarish muscle in the superior aspect of the lateral thigh. It acts as a synergist of the gluteus medius and iliopsoas in flexing and abducting the thigh. It also helps stabilize the lateral aspect of the knee by pulling on the iliotibial tract band, making it taut. Deep to the gluteus maximus, the piriformis, obturator internus, obturator externus, superior gemellus, inferior gemellus, and quadratus femoris, laterally rotate the femur at the hip. The adductor longus, adductor brevis, and adductor magnus can both medially and laterally rotate the thigh depending on the placement of the foot. The adductor longus flexes the thigh, whereas the adductor magnus extends it. The pectineus adducts and flexes the femur at the hip as well. The pectineus is located in the femoral triangle, which is formed at the junction between the hip and the leg and also includes the femoral nerve, the femoral artery, the femoral vein, and the deep inguinal lymph nodes. Thigh muscles that move the femur, tibia, and fibula. Deep fascia in the thigh separates it into medial, anterior, and posterior compartments. See Figure 1 and Figure 3. The muscles in the medial compartment of the thigh are responsible for adducting the femur at the hip, along with the adductor longus, adductor brevis, adductor magnus, and pectineus. The strap-like gracilis adducts the thigh in addition to flexing the leg at the knee. The muscles of the anterior compartment of the thigh flex the thigh and extend the leg. This compartment contains the quadratus femoris group, which actually comprises 4 muscles that extend and stabilize the knee. The rectus femoris is on the anterior aspect of the thigh. The vastus lateralis is on the lateral aspect of the thigh. The vastus medialis is on the medial aspect of the thigh. And the vastus intermedius is between the vastus lateralis and vastus medialis and deep to the rectus femoris. The tendon common to all 4 is the quadriceps tendon, patellar tendon, which inserts into the patella and continues below it as the patellar ligament. The patellar ligament attaches to the tibial tuberosity. In addition to the quadriceps femoris, the sartorius is a band-like muscle that extends from the anterior superior iliac spine to the medial side of the proximal tibia. This versatile muscle flexes the leg at the knee and flexes, abducts, and laterally rotates the leg at the hip. This muscle allows us to sit cross-legged. The posterior compartment of the thigh includes muscles that flex the leg and extend the thigh. The three long muscles on the back of the knee are the hamstring group, which flexes the knee. These are the biceps femoris, semitendinosus, and semimembranosus. The tendons of these muscles form the popliteal fossa, the diamond-shaped space at the back of the knee, muscles that move the feet and toes. Similar to the thigh muscles, the muscles of the leg are divided by deep fascia into compartments. Although the leg has three, anterior, lateral, and posterior, Figure 4 and Figure 5, the muscles in the anterior compartment of the leg, the tibialis anterior, a long and thick muscle on the lateral surface of the tibia, the extensor hallucis longus, deep under it, and the extensor digitorum longus, lateral to it, all contribute to raising the front of the foot when they contract. The fibularis tertius, a small muscle that originates on the anterior surface of the fibula, is associated with the extensor digitorum longus and sometimes fused to it, but is not present in all people. Thick bands of connective tissue called the superior extensor retinaculum, transverse ligament of the ankle, and the inferior extensor retinaculum hold the tendons of these muscles in place during dorsiflexion. The lateral compartment of the leg includes two muscles, the fibularis longus, peroneus longus, and the fibularis brevis, peroneus brevis. The superficial muscles in the posterior compartment of the leg all insert onto the calcaneal tendon, Achilles tendon, a strong tendon that inserts into the calcaneal bone of the ankle. The muscles in this compartment are large and strong and keep humans upright. The most superficial and visible muscle of the calf is the gastrocnemius. Deep to the gastrocnemius is the wide, flat soleus. The plantaris runs obliquely between the two. Some people may have two of these muscles, whereas no plantaris is observed in about 7% of other cadaver dissections. The plantaris tendon is a desirable substitute for the fascia lata in hernia repair, tendon transplants, and repair of ligaments. There are 4 deep muscles in the posterior compartment of the leg as well. The poplitus, flexor digitorum longus, flexor hallucis longus, and tibialis posterior. The foot also has intrinsic muscles, which originate and insert within it, similar to the intrinsic muscles of the hand. These muscles primarily provide support for the foot and its arch, and contribute to movements of the toes. Figure 6 and Figure 7. The principal support for the longitudinal arch of the foot is a deep fascia called plantar aponeurosis, which runs from the calcaneus bone to the toes. Inflammation of this tissue is the cause of plantar fasciitis, which can affect runners. The intrinsic muscles of the foot consist of 2 groups. The dorsal group includes only one muscle, the extensor digitorum brevis. The second group is the plantar group, which consists of 4 layers, starting with the most superficial. Chapter review. The pelvic girdle attaches the legs to the axial skeleton. The hip joint is where the pelvic girdle and the leg come together. The hip is joined to the pelvic girdle by many muscles. In the gluteal region, the psoas major and iliacus form the iliopsoas. The large and strong gluteus maximus, gluteus medius, and gluteus minimus extend and abduct the femur. Along with the gluteus maximus, the tensor fascia lata muscle forms the iliotibial tract. The lateral rotators of the femur at the hip are the piriformis, obturator internus, obturator externus, superior gemellus, inferior gemellus, and quadratus femoris. On the medial part of the thigh, the adductor longus, adductor brevis, and adductor magnus adduct the thigh and medially rotate it. The pectineus muscle adducts and flexes the femur at the hip. The thigh muscles that move the femur, tibia, and fibula are divided into medial, anterior, and posterior compartments. The medial compartment includes the adductors, pectineus, and the gracilis. The anterior compartment comprises the quadriceps femoris, quadriceps tendon, patellar ligament, and the sartorius. The quadriceps femoris is made of 4 muscles: the rectus femoris, the vastus lateralis, the vastus medius, and the vastus intermedius, which together extend the knee. The posterior compartment of the thigh includes the hamstrings, the biceps femoris, semitendinosus, and the semimembranosus, which all flex the knee. The muscles of the leg that move the foot and toes are divided into anterior, lateral, superficial and deep posterior compartments. The anterior compartment includes the tibialis anterior, the extensor hallucis longus, the extensor digitorum longus, and the fibularis, peroneus, tertius. The lateral compartment houses the fibularis, peroneus, longus and the fibularis, peroneus, brevis. The superficial posterior compartment has the gastrocnemius, soleus, and plantaris, and the deep posterior compartment has the poplitus, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. Make sure to smash the like and subscribe buttons to receive notifications all new contents.